if you're over 70 or you care about someone who is. This video is especially for you. We've been told for decades that routine screenings and yearly tests are the key to staying healthy. But recent medical research shows that some of these routine tests may actually do more harm than good in older age. Hi, I'm Dr. Charlie Anderson. I've spent over 35 years working with older adults as a geriatric specialist, and if there's one thing I've learned, it's this. More tests don't always mean better health. In this video, I'm going to walk you through 10 medical tests that should not be done routinely after the age of 70 unless there's a specific medical reason. These include things like full-body CT scans, yearly mammograms, and even certain cancer screenings. You'll be surprised at how outdated some common practices have become. I'm not here to scare you. I'm here to empower you with real information, backed by science. I'll also explain when these tests do make sense, and how to talk to your doctor about them confidently. Before we dive in, I'd love to get to know you a little. Drop your first name, age, and country in the comments, and tell me what health issue concerns you the most right now. I personally read each comment and try to respond when I can. Now, let's get into the truth about these common tests, and why less can sometimes be more. Number 10. Routine full-body CT scans. They're often marketed as total body checkups, a way to catch silent problems before they become serious. Sounds smart, right? But after 70, full-body CT scans can actually do more harm than good. First, let's talk about radiation. A single full-body CT exposes you to the same radiation as hundreds of chest X-rays. That's a lot, especially if it's being done every year or two. And when you're older, your body's ability to recover from radiation damage is lower. Now here's the catch. Most of the time, these scans find things that aren't dangerous at all, like small nodules, cysts, or age-related changes that are completely harmless. But once something shows up, doctors usually feel the need to investigate further. That can mean follow-up tests, biopsies, or even surgeries that were never actually needed. It's called the cascade effect. One harmless finding leads to a chain of stressful, expensive, and risky procedures. A study published in JAMA Internal Medicine found that many seniors who had full-body scans ended up undergoing procedures that didn't improve their health, and in some cases, led to complications. So why are these scans still recommended? Sometimes it's fear, sometimes it's habit, and sometimes it's simply good marketing. People like the idea of catching things early, even when there's nothing to catch. But here's the truth. If you feel fine and you don't have specific symptoms, there is no reason to scan your entire body. No major health organization recommends full-body scans for healthy adults, and certainly not for people over 70. So what should you do instead? Talk to your doctor. Focus on targeted tests only if you have symptoms, risk factors, or a known condition. Keep up with routine physicals, manage chronic conditions, and stay active. These steps will protect your health far more than exposing your body to unnecessary radiation. Remember, after 70, less is often more. A full-body CT scan might give you peace of mind at first, but it could also send you down a road of worry, expense, and treatments you didn't need. So ask, is there a reason for this scan? If not, the best choice might be to skip it. Number 9. Routine stress tests for heart disease. If you've ever walked on a treadmill while hooked up to wires, you've probably had a stress test. It's designed to check how well your heart works under pressure. But if you're over 70 and you don't have heart symptoms, doing these tests regularly may cause more harm than good. Here's why. Stress tests can lead to false positives, test results that look abnormal but don't reflect real heart disease. And in older adults, even small abnormalities can lead to angiograms, stents, or even bypass surgery, none of which may be necessary. A major study from the Cleveland Clinic found that in seniors without symptoms, routine stress testing didn't improve outcomes. In fact, many of these tests led to invasive procedures that had no benefit and carried real risks like bleeding, infection, or heart rhythm problems. So who should get a stress test? If you're having symptoms like chest pain, shortness of breath during exercise, or unexplained fatigue, then yes, your doctor may recommend one. But for routine screening, experts, including the American College of Cardiology, say no. Unfortunately, many doctors still order them out of habit or just to be extra cautious, and some patients even request them, believing it's a safe checkup. But there's nothing safe about opening arteries that didn't need fixing in the first place. If you've already been diagnosed with heart disease, or you've had a heart attack in the past, your cardiologist may still use stress tests to monitor your progress. But if you're otherwise healthy, over 70, and symptom-free, you don't need to go through the stress. Literally. Instead, focus on prevention. Keep your blood pressure, cholesterol, and blood sugar under control. Move your body every day. Eat a heart-healthy diet, get regular sleep, and avoid smoking. These daily habits are far more powerful than a test that might show a problem that isn't even there. So before you agree to a treadmill test, ask your doctor one simple question. Do I need this because of a real symptom? Or are we just checking? If it's just routine, it's probably time to skip the test and go for a real walk instead. Number 8. Carotid artery screening for stroke risk. This test uses ultrasound to check for plaque buildup in the neck arteries, the ones that carry blood to your brain. It sounds useful, especially if you're afraid of strokes. But for people over 70 without any symptoms, this test might do more harm than good. Let's start with the basics. Yes, strokes are serious. And yes, blocked carotid arteries can lead to a stroke. But here's the key. Serious blockages are usually accompanied by symptoms like dizziness, fainting, or mini-strokes, also called TIAs. If you haven't had any of these signs, routine screening often finds small, non-dangerous buildups that don't require surgery. The U.S. Preventive Services Task Force, one of the top health guideline organizations, strongly advises against routine carotid artery screening in healthy people without symptoms. Why? Because of what happens next. Once a blockage is found, even a small one, many doctors feel the need to operate. That often leads to carotid artery surgery, which carries risks like stroke, heart attack, or even death. Studies show that many of these surgeries were done on people who never would have had a stroke in the first place. And here's something else. Ultrasound isn't perfect. It can misread small plaques as dangerous ones. That means more stress, more follow-up scans, and sometimes unnecessary operations. So why is this test still offered? Sometimes it's part of executive health checkups. Sometimes it's used as a screening tool at health fairs. But just because a test is available doesn't mean it's safe or helpful. If you do have symptoms, like trouble walking, numbness, or slurred speech, then yes, your doctor may recommend this test. But if you're healthy and over 70 with no signs of stroke, you probably don't need it. Instead, reduce your stroke risk the smart way. Control your blood pressure. Eat a Mediterranean-style diet. Walk daily. Don't smoke, and get regular checkups. These habits will do more to protect your brain than any scan ever could. So before saying yes to a carotid artery screening, ask yourself, do I have symptoms? Or am I just looking for problems I don't have? If it's the second one, you might be better off skipping the scan and focusing on your real health instead. Number 7. Routine blood tests for tumor markers. These tests sound like something every senior should do. After all, they claim to detect early signs of cancer by measuring specific substances in your blood, called tumor markers. But here's the truth. For healthy people over 70, using these tests as a routine checkup tool often causes more confusion, anxiety, and harm than benefit. Tumor markers like CEA, CA125, PSA, AFP, and others are meant to track cancer progress after a diagnosis, not to screen for cancer in people who feel fine. Why? Because these markers are not always accurate. They can be high for many reasons other than cancer, such as infections, inflammation, age-related changes, or even medications. And sometimes they're completely normal even when cancer is present. That's what makes them unreliable for routine use. False positives are common. One test result may come back slightly elevated, and suddenly you're going through CT scans, biopsies, or even surgery to chase something that was never dangerous. A report by the American Society of Clinical Oncology strongly advises against using tumor marker blood tests as general screening tools, especially in older adults without symptoms. The evidence shows they don't improve survival rates, but they do increase stress and overtreatment. So why are they still being done? Some doctors use them just to be safe. Others may order a panel of blood tests out of habit. And in private healthcare, they're often part of fancy executive health packages that sound impressive, but aren't backed by science. Instead of looking for cancer in places where it may not exist, focus on your actual health. Are you feeling well? Any new symptoms like unexplained weight loss, persistent pain, or fatigue? That's when targeted testing is helpful. But without symptoms, tumor marker tests are like trying to find a needle in a haystack, and sometimes the needle isn't even there. After 70, your body may show small fluctuations in blood markers, but not every blip is a danger. Trust your doctor to investigate real symptoms, not numbers on a report. So unless you're already being treated for cancer or you're showing clear warning signs, there's usually no need to check tumor markers every year. Remember, health is more than test results. Stay active, eat well, get your screenings only when necessary, and don't let one lab number shake your peace of mind. Number 6. Routine thyroid function tests. Your thyroid controls metabolism, energy, and body temperature. It's important. No doubt about it. But here's the surprising truth. If you're over 70 and you're feeling fine, doing thyroid tests every year is usually unnecessary, and sometimes even harmful. Let's break it down. The thyroid test most doctors order is called TSH, thyroid stimulating hormone. It checks whether your thyroid is overactive, hyperthyroidism, or underactive, hypothyroidism. But after age 70, TSH levels naturally rise, even in healthy people. That means many older adults get flagged as having subclinical hypothyroidism, a very mild, often harmless condition that doesn't cause symptoms and usually doesn't need treatment. Unfortunately, once it shows up on your test results, it often leads to prescriptions for thyroid hormone pills. But studies show that treating mild thyroid dysfunction in seniors doesn't improve energy, weight, or mood, and can even cause harm, like heart rhythm problems or bone loss. A large study published in the New England Journal of Medicine found no benefit from treating subclinical hypothyroidism in older adults. That's why organizations like Choosing Wisely and the American Thyroid Association now recommend against routine thyroid testing in seniors who don't have symptoms. So why is it still done? Habit, checkups, and sometimes just because it's on the panel. But here's what's better. If you're feeling tired, gaining weight quickly, always cold, or noticing hair thinning, that's the time to talk to your doctor about a thyroid check. In those cases, testing makes sense. But if you're symptom-free, testing every year doesn't protect your health. It creates unnecessary worry and often unnecessary medication. What should you focus on instead? Keep your weight steady, eat iodine-rich foods like seafood and eggs, avoid excessive supplements, and check in with your doctor if something feels off. Remember, normal age-related changes are not always problems that need fixing. Let your symptoms guide your tests, not just the calendar. So next time your blood test list includes thyroid function, just because, ask if it's really needed. If you're feeling good, it may be one test to cross off your routine. Number 5. Bone density scans for osteoporosis, also called DEXA scans. Osteoporosis is a real concern. It weakens bones and increases the risk of fractures. That's why doctors recommend a bone density scan, especially for women around age 65. But if you're over 70 and already being treated, doing this scan every year or two might do more harm than good. Here's why. Bone loss happens very slowly. If you're taking medications like Fosamax, Reclast, or Actinol, studies show that your bone density remains stable for years. In fact, A major study published in the New England Journal of Medicine followed older women on treatment and found that scanning every 1 to 2 years didn't change any outcomes. The women's bone health stayed steady whether they scanned often or not. So what's the harm in repeating the test? Frequent scans can show small, meaningless changes that trigger alarm, even when there's no real danger. That can lead to unnecessary changes in medication, extra tests, and emotional stress over something that's not actually getting worse. So why do doctors still recommend yearly scans? Sometimes it's habit. Other times it's defensive medicine, doing more just to be safe. But the reality is, most experts now recommend waiting 3 to 5 years between scans if you're stable and already on treatment. Here's when you should scan again. If you've had a recent fracture, if you've stopped your medication, if you've had a major health change, or if you never started treatment and your doctor wants to evaluate your baseline. Otherwise, focus on what actually protects your bones. Take your medications as prescribed. Get enough calcium and vitamin D. Do weight-bearing and balance exercises and reduce fall risks in your home. These steps prevent fractures, not the scan itself. So if your last bone scan was fine and nothing's changed, ask your doctor, do I really need this again so soon? In many cases, you'll be better off skipping the scan and stepping into stronger health with simple daily habits. Number 4. Routine PSA screening for prostate cancer. The PSA test is a simple blood test that checks for levels of prostate-specific antigen, a protein linked to prostate cancer. Many men have taken it regularly since turning 50, and it may have even saved lives. But after 70, routine PSA screening can cause more harm than good. Here's why. Prostate cancer usually grows very slowly, especially in older men. In fact, most men who are diagnosed with it never experience symptoms or complications. They die with prostate cancer, not because of it. When you get a PSA test, even a slightly high number can set off alarms. That often leads to biopsies, which can be painful and risky. Worse, it may lead to treatments like surgery or radiation, which can cause side effects like urinary incontinence, erectile dysfunction, and other long-term issues. A major study in the New England Journal of Medicine showed that PSA testing in older men didn't reduce mortality, but it did lead to overdiagnosis and overtreatment. That's why the U.S. Preventive Services Task Force recommends against routine PSA screening after age 70, unless you're showing symptoms or have specific high-risk factors. So why do people still get the test? Sometimes it's habit, sometimes it's fear, and sometimes it's because we've been told for decades that early detection is always better. But in this case, that's not always true. If you've never had prostate cancer and you're not experiencing symptoms like trouble urinating, pelvic pain, or blood in urine, then continuing PSA tests after 70 may only lead to more worry, not better health. Here's a better approach. Know the symptoms. Talk with your doctor if anything feels different. Maintain a healthy lifestyle with regular exercise, good diet, and weight management. Prostate health is important, but testing for testing's sake isn't the answer. So if you're over 70 and your doctor suggests a PSA test, ask, is there a reason, or is this just routine? If it's the latter, it may be time to skip the needle and focus on true health instead. Number 3. Annual mammograms for breast cancer. Mammograms have been the gold standard for early breast cancer detection, especially for women over 50. But after 70, the picture becomes more complicated. If you're healthy and still have a life expectancy of 10+ years, a mammogram might still make sense. But doing it automatically every year? That may not be the best choice. Here's why. Breast cancer in older women often grows slowly, and many women over 70 die with breast cancer, not from it. Meanwhile, false positives, when the test shows something suspicious that turns out to be harmless, become more common with age. Those false alarms lead to more scans, biopsies, and emotional stress, and sometimes even unnecessary treatments like surgery, radiation, or chemotherapy. all of which carry risks and may not improve survival in older women. According to the American Cancer Society and the U.S. Preventive Services Task Force, women over 75 should talk to their doctor about whether mammograms are still helpful, based on personal health and risk. So why do some women continue to get them every year? It's often habit or fear, and for some it's because they feel safer keeping up the routine. But routine doesn't always equal benefit. If you're healthy, active, and expected to live for another 10+ years, continuing mammograms every 2 years might still be reasonable. But yearly screening? Often unnecessary, and sometimes harmful. If you've had consistently normal mammograms, have no family history, and no new symptoms like lumps, nipple discharge, or skin changes, talk with your doctor about whether you still need them. More important than testing is knowing your body and reporting any changes. Also, stay physically active, maintain a healthy weight, limit alcohol, don't smoke. These lifestyle habits reduce your risk far more than yearly x-rays ever could. So if your calendar says it's mammogram time, pause and ask, do I really need this at my age? Or is it just a leftover habit? For many women, the answer is, it's okay to stop. Number 2. Routine. Pap smears for cervical cancer. Pap smears are one of the most effective cancer screening tools in history. They've saved countless lives by detecting cervical changes before cancer develops. But after age 65, especially if you've had normal results, routine pap smears are no longer necessary. Let's look at the facts. Cervical cancer is extremely rare in women over 70, especially if they've had regular pap tests in the past that were normal. The risk drops even lower if you've also tested negative for HPV, the virus that causes most cervical cancers. The U.S. Preventive Services Task Force, the American Cancer Society, and gynecological associations all agree, if you're over 65, have had at least 3 normal pap tests in the past 10 years, and don't have a high-risk history, you can safely stop screening. So why do some women still get pap smears after 70? In many cases, it's out of routine. Some clinics auto-schedule them. Other times, it's a lack of updated guidance. But unnecessary pap tests can lead to false positives, anxiety, uncomfortable follow-up tests, and even procedures like colposcopy or biopsies, none of which are pleasant, especially at an older age. If you've had a hysterectomy for non-cancer reasons and your cervix was removed, you likely don't need pap tests at all. Here's what matters more: knowing your medical history, being alert for unusual bleeding or pelvic pain, communicating openly with your doctor. So unless you've had a history of cervical cancer or precancer, you can confidently skip pap tests after 70. Ask your doctor, do I still need this test, or can I cross it off my list? In most cases, pap smears after 65 to 70 belong in the past, and not in your future. Number 10. Colonoscopy for colorectal cancer. Colonoscopy is a powerful tool. It detects and even removes colon polyps before they turn into cancer. Most people are advised to get their first colonoscopy at age 45 or 50. But by the time you reach 75 or older, especially if you've had normal results, routine colonoscopies may no longer be needed. Why? Because the risks increase with age. Colonoscopy is not a simple test. It requires full bowel prep, sedation, and inserting a camera into the colon. For seniors, the risks include bleeding, infection, perforation, a tear in the colon, and complications from anesthesia. A study published in JAMA Internal Medicine found that routine colonoscopy in people over 75 didn't improve outcomes, but it did increase complications. That's why the U.S. Preventive Services Task Force recommends stopping routine colonoscopy after age 75, unless you're in excellent health and your doctor believes you'll live another 10+ years. So why is it still common? Because many people think more screening equals better health? But at a certain age, the benefits shrink and the harms grow. If you've had 1 or 2 normal colonoscopies already, your risk is low. And if you have no symptoms like blood in the stool, unexplained weight loss, or changes in bowel habits, there's usually no reason to repeat it. Instead, if screening is still needed, there are safer, less invasive options like stool tests, FIT, or Cologuard that can often be done from home. What's more important? Staying active, eating fiber-rich foods, avoiding smoking and heavy alcohol, and talking to your doctor if something feels wrong. So before scheduling another colonoscopy, ask, am I doing this because I need it, or just because it's been 10 years? For many healthy seniors, it's okay to stop. Focus on living well, not testing more. So there you have it. 10 medical tests that may not be necessary after age 70 unless there's a clear medical reason. Let me be clear. I'm not saying these tests are bad. What I'm saying is that in many cases they offer no benefit, create anxiety, and sometimes lead to more unnecessary procedures or medications, especially in older adults with stable health. Remember, the goal of healthcare after 70 should shift from find everything to live well and avoid harm. Focus on what actually makes a difference. Movement, good food, sleep, strong bones, balance, and connection with others. That's the real medicine. If this video helped you, please give it a thumbs up and share it with someone you care about, especially if they're over 65 or helping care for an older family member. Now it's your turn. What was the most surprising test on this list for you? Drop it in the comments. Also, if there's a test or health concern you're confused about, let me know. Your questions help shape my future videos. And don't forget to subscribe to the channel for more science-based, no-nonsense advice for healthy aging. Until next time, I'm Dr. Charlie Anderson. Stay strong, stay informed, and take care of your body. But don't let fear drive your healthcare choices.